Okay. While we wait for people to come in, let me stream to Facebook. Okay, hi everyone. Just give me 1 second. We are setting up our streaming to Facebook, and it's giving me an error message. I hope everyone had a great 4th of July weekend, 4-day weekend for some, 3-day weekend with a break, a break in the middle for some, a break from a break, aka back to work. Okay, I'm not sure if this is working, but let's just begin. I will share my screen. Okay. Thank you everyone for joining us for this broad bag on screening for diabetes. You may be familiar with this topic. You may have even gotten yourself or family members screened before, or this may be a completely new topic to some of you. We're here to educate you about it. So if you are new to DPAC, our role is to educate, inspire, and empower patient advocates as well as lawmakers to make meaningful action on diabetes. So we train advocates in the diabetes community, and we also educate lawmakers on the experiences of people with diabetes. And here are our 3 featured speakers today, more of a panel. So we can start with Tom. Tom Boyer is the Senior Director of Public Affairs and Advocacy at the Diabetes Leadership Council. Tom has over 20 years of experience rooted in driving and securing improvements in diabetes care and insurance coverage via government affairs or lobbying, public affairs, public relations, and patient advocacy. His career spans work on behalf of pharmaceutical, biotech, medical device manufacturers, nonprofit patient organizations, professional associations, and related interests to drive diabetes care improvements. He's also worked nationally with nationally recognized and often little-known elected officials or administrative staff at the federal and state levels to achieve these diabetes care improvements. Our next panelist is Kristian Hurley. Kristian is the Senior Vice President of Programs, Advocacy, and Health Equity at Beyond Type 1, a name I'm sure many of you are familiar with. Beyond Type 1 is a nonprofit dedicated to changing what it means to live with diabetes through platforms, programs, resources, and grants. Previously, she served as the Executive Director of Development and Community Health at the American Heart Association of Southeastern Michigan. Kristian is recognized for her leadership, advocacy, and community impact, having received the 2023 Michigan Chronicle Women of Excellence Award and being named a notable women in nonprofits by Crain's Detroit Business. And we have finally, last but not least, Randall Barker. He is a DPAC advocate, a DPAC champion who actually joined us on the Hill in May as well. Randall has been living with type 1 diabetes for over 33 years and is also a dedicated father to a daughter who has been managing the condition for over 10 years. Professionally, Randall serves as a pollution control specialist for a local municipality in North Texas, where he applies his expertise in environmental protection. Randall's commitment to diabetes advocacy was ignited when his daughter was diagnosed with type 1 diabetes in 2013. Since then, he has actively engaged with and written articles for several prominent diabetes organizations. So we have an amazing panel with us today. I will stop sharing now and get started with the questions that we have prepared. So the first one is directed toward Tom. Many of us in the diabetes community don't know about the stages of diabetes. What are the stages and what are the characteristics of each stage?
Sure. So first off, Kristian and I have been on a number of panels together, and this is the first time that I'm realizing we're each from Southeastern Michigan. I grew up in Ann Arbor and Brighton and Walled Lake, so right on. Go Blue for anyone that is a fan of the Maize and Blue, and if not, find a way to become a fan is my counsel to you. So briefly, I'm going to stick with the trial net definition of the stages of type 1 diabetes and try to discuss a little bit about what the differences are between screening for type 1 versus screening for gestational and type 2 diabetes. When we screen for type 2 and gestational diabetes, we're screening to diagnose the presence of the disease, meaning that there are things that are happening in the body that are indicative already of gestational diabetes and type 2 diabetes being in place and doing some physiological things to the body. Type 1 diabetes, different type of screening. In this case, we're trying to screen for these things called autoantibodies. And these autoantibodies have this way of really unmasking themselves over time and then leading to type 1 diabetes. So entirely different type of screening, we hope. And now we can screen for type 1 diabetes in these stages. So from a trial net point of view, if you look at other definitions, you will see other people using a different definition set. So I'm going to stick with trial net. If you have 2 of 4 autoantibodies, you are diagnosed as being in stage 1, and we can begin screening for the presence of these autoantibodies around the age of 2. That's where we see that we have real predictability and really repetition of that predictability over the course of someone's life. So if you have 2 of these 4 autoantibodies, or 3 or 4 or 4 or 4, you are in stage 1. But there are no other changes that are happening to your body. Stage 2 begins, and this is where it gets to be really important with certain new therapies and other products that are in clinical development from a research point of view. Now there are certain physiological things that are starting to happen to the body, and that's where a lot of folks want to catch this folks who are progressing into stage 3, because there's some things that maybe can be done to combat the condition and forestall it. Then stage 3, that's full on type 1 diabetes, usually diagnosed in diabetic ketoacidosis. That's what we want to avoid. And if you want a reading or a resource that you can go to, some reading material on this topic, we on the DLC DPAC side run a website that's sponsored and supported by a number of organizations called Getting Ahead of Type 1, gettingaheadoftype1.org. That's the number 1. You can also use Getting Ahead of T1D.org, and you'll get there. But it really coalesces and condenses this information, and everything that I just shared with you is presented there on that website. Did I tackle that for you, Amanda?
Yeah, that was amazing. Thank you.
Sure.
Yeah, the stages of diabetes is something that I think people in the diabetes community were not very aware of until the recent research came out, and the screening initiative has really started.
All brand new. When
Yeah.
I say brand new, I mean we're some of this is within 6 months, and there are new guidelines that have just been published, which we'll get to as we go.
Thank you. Yeah. Our next question is toward Kristian. What exactly does it mean to screen for type 1 diabetes? What are the benefits of screening, and how could one go about getting screened? And can you tell me a little bit about why Beyond Type 1 is interested in this and what actions you are taking to share that message?
Yes, that's a mouthful. I might need a secondary
Yes,
talk.
multi-pronged, yes.
No worries. I think Tom sort of answers some of this, right? I mean, a type 1 screening is a very simple blood test that you can get from various sources that I can share, but essentially it's an autoantibody test, and you're looking for the presence of diabetes-related autoantibodies, that are circulating in your body. And as Tom said, technically a negative test would be anywhere from 0 to 1 antibodies. But if you have 1, that just means that you're, maybe more at risk for developing more. And so you want to potentially retest, maybe even annually, to make sure that you have not developed additional ones. If you have 2 autoantibodies, then that's seen as, you are in the second stage of developing type 1 in the very early stages. And so at that point, you would want to talk to your doctor about, creating a monitoring plan and a management plan, and just really getting out in front of it so that should you move into stage 3, you'll be prepared. Some of the benefits for screening early for type 1 are really there are multi benefits, but I think one of the big ones is not being diagnosed in crisis. Most individuals who get diagnosed with type 1 do so in an emergency setting, and in that state of diabetic ketoacidosis. And so it's very important to be on type 1. Our mission is all about helping our community members to survive and to thrive. And, the paramount of that is to make sure that people get an easy and safe and quick diagnosis that is not in crisis. And we can do that with early diagnosis and screening. It can also really help families get out in front of this diagnosis. More than 80% of people who get diagnosed with type 1 have absolutely no family history. So it's a little bit of a fallacy that there's this thinking that it only occurs like in our type 1 families, right? And that is true. 15%, you are 15 times as likely to develop type 1 if you have an immediate family member, but so many individuals do not have that connection. And so for families to get out in front of it and get early screening, and they don't have that connection within the family, they can begin to learn about type 1 and prepare themselves and educate themselves, learn the signs so that they can have a softer landing and better outcomes for themselves or for their family members. Did I get all your questions?
Yes, thank you so much. The only follow-up question I had is, could you tell me a little bit about why Beyond Type 1 is interested in this, and what Beyond Type 1 is doing?
Yeah, great. Great question. Don't want to miss that one. So we're interested in this because, as many of you might know, we have long had a campaign called See the Signs, which is all about helping individuals learn the signs of type 1 and type 2 diabetes so that we can reduce DKA at diagnosis. But now we're taking it a step further, and we're taking that campaign and we're leveraging our about 3,000 ambassadors that we have under our See the Signs campaign, and we're giving them the tools and the resources that they need to not only educate their communities about the signs of diabetes, but also what they can do, hence early screening. And so we love this because this is giving our ambassadors and our community members a more actionable call to action, right? Getting people to know that awareness, but also giving them something that they can do to truly be able to shift that narrative and reduce that DKA at diagnosis. And so we have created new toolkits and resources that help individuals understand the different stages of diabetes, as Tom so eloquently shared with us. What is screening? What are those autoantibodies that you're looking for? Where you can seek screening. So we've got resources that provide all the different kits that you can get in your home, how to have conversations with your doctor to request an autoantibody screening. This sometimes doesn't always go as easily as you might imagine. And so we give them discussion guides and questions to ask, and what to respond to if you get an objection from your clinician on whether or not you should be screened. And so we have all of these resources in our See the Signs ambassadors toolkits for individuals who might just want to know this information for their own families and for themselves, but also to empower our communities with this information so that you can take these toolkits and resources into your sphere of influence, your workplace, your schools, the place where you worship, and share all of these resources and information so that people can be empowered. And we also have educational modules that go along with that toolkit. So maybe your school invites you to give a presentation, with your PTO or some other organization, your sorority or your fraternity, and now you have a resource where it's a ready-made educational module where you can go and educate your community on all of this plethora of resources. And so our big call to action is for people to become ambassadors so that they can get these tools and these resources and educate their communities. We have quarterly sort of support sessions for our ambassadors where we provide them new resources, we train them, we tell stories from our community of individuals who are living with type 1 and can really further help people understand the impact of type 1 in our communities. And so, yeah, we love for people to visit our website, beyondtype1.org, and check out our See the Science page, become ambassadors, and download some of the resources.
Thank you so much. That's so much information. And I think it actually addresses some of the Q&As we had about how to go about beginning this process. I saw, Tom, you requested to answer a question live. Unless that was an accident.
I just answered it. I just answered one of them.
Oh,
So
okay.
sorry.
I think she was asking for a link.
I'm trying to answer on the fly, trying to help.
Yeah, and another question was asking about how we get doctor's offices to test. I think that is actually a good tie-in to our next question for our next panelist, Randall, who has experience getting screened. Randall, you do have family members who have gone through this process. Why did you choose to get screened, and why did you choose to have them get screened, and what has your experience been?
Yeah, so with my experience, my daughter, who when you touched on with the bio, she's also a type 1. And she was not symptomatic when she was diagnosed. She was, well, I say she was on the verge of DKA, but not full blown. She wasn't exhibiting those typical symptoms that me as a type 1 I should have been looking for, or would have triggered, hey, this is something to check out. So she went on, was diagnosed, luckily avoided DKA. However, she has 2 siblings. I have 2 other sons that given that family history and kind of that closeness that we got to there of how close she came to being undiagnosed for that amount of time, we thought, yeah, we should do the type 1 screening. And it was, I believe at that time, we were actually at a conference, Children with Diabetes, and they were doing the TrialNet was there doing screenings. And that was one of the places that we did the screening with. And my sons, both of them have come back negative. We've actually gone back twice to have it done, have them tested. And yeah, so that's my experience, kind of taking that a step forward and talking about with the conversation with the doctor. So my daughter just had a daughter, so I now have a granddaughter who she's going to have that immediate family, her mother as well as her grandfather who has type 1. We've already had that conversation with her pediatrician that we want to get type 1 screening done, and he's on board with it, thankfully, and so is ready to order that test when we decide it's appropriate.
Yeah, thank you so much for sharing that. We're glad to hear that the process has worked well for you, and that we're looking forward to it happening again with your grandkids. Tom, I know you're diligently answering the Q&A questions, but we have another question for you, which is, what do you see as a policy need around type 1 diabetes screening, and what is the diabetes advocate's role in this?
The diabetes advocate's role is immense in this topic. Just to establish a baseline for everybody, the federal government and state governments don't necessarily have many resources available when it comes to type 1 diabetes. They're much better at providing information for conditions that can be prevented and detected for much earlier on than type 1 diabetes can. They're also very good when it comes to testing newborns and others for things like cancer. So we're very far behind when it comes to public health programs and initiatives for type 1 diabetes interests. We are doing what we can to change that in some pretty assertive ways. Right now, there are provisions that are in the labor HHS appropriations vehicle that stands a much better chance in the Senate than I think it does in the House because of some political things that are going on. if folks aren't aware, we're in a political firestorm at the moment, for lack of a better way to put it. There's a lot that's going on because we're in a presidential election season, so it's become an interesting exercise in democracy for a lot of folks. Some would say frustrating. I prefer to use interesting because the process is the process, and I've been doing this for a little while. So the role that we have here is very important. So I talked a little bit about what we're doing at the federal level. We have this appropriations bill. Now, Representative Schreier at an event that our friends at Beyond Type 1 hosted about 2 weeks ago in Washington, D.C., dropped a bill that would ultimately obligate the CDC to run a type 1 diabetes campaign of some form within the next few years, and it allocates about $5 million a year to that exercise. DLC, DPAC, ADA, Breakthrough T1D, we're all supportive of this bill and seeing it become a reality. But the bottom line is we need as much help as we can get from the community weighing in on these vehicles, because as one of the questions alluded to, we have scant data, we have scant resources, and these are our initial toeholds to get things going. We also have a bunch of bills running at the state level to obligate, upon a child's entry into a public school setting, that information be shared with families who are at risk for type 1 diabetes, in particular if there's a biological relative in the household or direct household relationships, whatnot, that has type 1 diabetes, that perhaps folks should contemplate getting screened, because that seems to be where the bulk of the consensus exists. If there's someone who's a biological relative, you should consider screening. But again, this is a personal decision, even though, and on top of that, the bulk of folks who are diagnosed with type 1 diabetes have no familial link. So we're building the plane as it's taken off down the runway based upon the scientific evidence that exists. And that's what the scientific evidence tells us right now. So we're pushing and we're getting involved at every level that we can.
Yeah, thank you. Thank you so much. Kristian, I realized you kind of pretty much answered this earlier, but I will ask you again just for a quick recap. What sorts of resources does Beyond Type 1 have on this subject? How can people get involved? And maybe as a way to kind of dig deeper, what do you recommend as a good first step or where to start?
Yeah, absolutely. I did mention, the toolkits and the resources, the one-pagers and the discussion guides for individuals to really be empowered to have this conversation, right? I mean, it's complicated, right? We're talking about auto antibodies and autoimmunity and, type 1 and type 2. And so sometimes it can be a little intimidating for individuals who might have an interest in exploring their risk and being proactive. And so our resources are really designed to give people that comfort and empowerment so that they know what to ask for, what conversations to have, and what resources are out there in the community. I think I'll we used to say veggie back instead of veggie back on top of what Tom just shared about advocacy. And I think it loops into what we are asking of the community as well around becoming ambassadors. Becoming an ambassador, yes, you'll get these resources, but you'll also be able to be in the know when these issues come to fruition, when we need you to tell your story. There is nothing more powerful than someone talking about, going into their clinician's office and not being able to get a screening. This happens every day where people will ask and may not be able to access that. We want people to talk about their diagnosis stories. We've done some surveying in a survey called The Cost of Not Knowing, and we've got so much feedback from our community members about the regret, that they wish they had known about screening, right? To be able to even take advantage of this. The cost, we know that getting a diagnosis is incredibly costly on top of the social and emotional impact and the physical and health outcomes of diabetes, but the trauma also that individuals exhibit when they are diagnosed in that state of emergency. And so this all comes from community members. And the only way that you're able to be able to share that with legislators, with our community, so that people can understand the urgency of what it is that we're trying to do, is by telling those stories. And so I guess the first step, yeah, engage with the Beyond Type 1 community, become an ambassador so that you can not only get these resources, but be invited to educational sessions, even like today, or, things that we might be doing to empower and educate community members, letting you know about new legislation or ways that you can take action. And obviously DPAC does so much of this as well, and we support everything that you all do, but people have to first get involved, become ambassadors, so that we can, get them engaged, yes, on this topic of screening, and get them the tools, the resources, and the actions that they can take to be able to make a difference.
Yeah, thank you so much. That's so helpful. Part of our job as DPAC, and I'm sure Beyond Type 1 is on the exact same page as well, is to provide people with all the background knowledge and all the resources they may need. And we say that the first step is getting informed, but you don't have to be an expert to the extent that we are, or that resources on Google or on anywhere are. You just need to tell your story and talk about why you think this is important, and we provide all the background information. Tom, I noticed you're answering some of the questions. Would you mind? I'm not sure if people on the call can see the answers that everyone can. I mean, that the people who asked them.
I'm answering them publicly.
Oh, okay, okay.
So, yeah,
okay, so
unless it was private and was sent to me, which has not been the case. Everything's public.
Okay, everyone, feel free to refer to the Q&A box. Tom is answering questions about health insurance and costs, and various other like medical related, family history, those types of questions. So feel free to refer to those. Next is Randall. You were recently on the Hill with DPAC advocating for a couple of different priorities for people with diabetes. And one item on our list was that we discussed with legislators is the topic of screening. What did you say in your Hill meetings, and how did you tie advocacy into screening?
Yeah, so getting up there, getting on Capitol Hill, and just sharing my story, sharing with the legislators how, especially with my daughter, how close we were, that she was almost on the verge of DKA, and kind of gave a synopsis of what DKA is and how it, the negative aspects of it and all that. And I related that back to the screening, saying if screening were more readily available, that this was something that they could probably do. This is cases of DKA or so forth could probably be prevented and everything. So they were open to that. Some of them were unaware even that screening was an option. So it was able to kind of educate those offices or legislators, and at least let them know that this was an option, that there was some bills or legislation being pushed through, and language and everything, that at least got that on their radar to hopefully have things pushed to kind of expand the screening and stuff. But mostly just getting out there, sharing my story of how I was impacted, and how trying not to go into those negative situations of DKA, and by having screening, I think that opened their eyes to the positivity of wanting to do more type 1 screening.
Yeah, thank you for sharing that. And we were all the DPAC advocates on the Hill were talking about this in their respective meetings as well. Because it's so new, I also had the experience that a lot of the people I talked to weren't aware of screening initiatives either. And the main thing that I think us as well we wanted to communicate is just that this is a new thing that's available, and that this is actually very vital and important, and it serves many benefits. So there's no specific, legislation for it currently, but we just want to the way that it's introduced as a first concept to these representatives is important, because we want to cement it as something very, very vital. And our last question is addressed to everyone on the panel. You are all tuned into the diabetes community and the dialogue surrounding the topic of screening. Why do you think people are choosing screening and or urging family members to get screened for diabetes?
Well, I can build upon what I shared earlier, in that, you know, a lot of times when we talk to community members, they're like, you know, screening wasn't available, you know, back when I was diagnosed, or, you know, I had no idea that this was even a thing, you know. And to Randall's point, you know, many family members have multiple children, and maybe one of their, you know, children have been diagnosed with type 1, and they want to know, because very oftentimes, you know, family members live with worry and concern over that, right? And so what we see is that, you know, people want a little bit of peace of mind, and, you know, they want to take advantage of that screening, so that, again, they can know, they can be on the lookout, and they can build a plan, right? And so I think that that's chief among them, right? Particularly for our individuals who are within the type 1 community and maybe have an immediate family member living with type 1. But also, you know, we work a lot in the general population and in diverse communities, and are talking much more about screening and type 1 in the general population. And people are learning more about the differences between type 1 and type 2, right? In a lot of underserved communities, they may never have really thought about type 1, because generally you only hear about type 2. And so as we raise awareness of this, people want to know their risk. You know, what does that mean for me, for my family? And so, you know, it starts with awareness. But once you have that awareness, what people want is they want to know their risk. They want to know how to assess this, to, you know, how to talk about it with their doctors, so that they can be proactive about their health, right? And so generally, people just want to ensure that yeah, you know, they're reducing any risk that they have to be diagnosed with type 1, particularly in that emergency state of DKA. And they want to reduce that likelihood.
Yeah, thank you so much. And on that note, someone commented that they wanted us to fully explain DKA, and I realized we're a bit late in the call, but yes, DKA is a life-threatening condition, diabetic ketoacidosis, where your blood ends up turning acidic because you don't have enough insulin to process the glucose in your blood. So the treatment usually is you get hooked up to IVs, you're in the ICU. It is generally, when you are diagnosed with diabetes, because we don't have screening, I forgot the exact percentage, but a huge percentage of people are diagnosed in this condition because they don't realize they have diabetes until they go into this condition. And then usually you have to immediately to the emergency room. And the amount of time that you spend in DKA as a person with diabetes should be as small as possible, if not zero, because it's a very life-threatening condition.
So couple of things to build off of that. Folks should keep in mind that the average age of diagnosis for type 1 diabetes in the United States is 29 years of age. And it's going up. It's not going down. Except there are a couple of trend lines, and we're not exactly sure why, where we are seeing, potentially as a result of COVID, potentially not. It depends upon which way the wind's blowing and the data set that comes through. We are seeing an increase potentially tied to a variety of other viral triggers that are leading to type 1 diabetes diagnosis, people in their 40s, people in their 50s, people who are younger. But we are seeing an uptick, and it's going up about 4% per year. And it's going up demonstrably in communities of color, demonstrably so, especially in the Hispanic audience and the African American communities. It's just where we are. And this disease is starting to look very different from what it looked like when I grew up with it, starting at the age of wherever I was to wherever I am now, which is old. There's a gap in there that we won't get into today, but there's just a lot going on. Now, if I could, just to offer a couple of thoughts about maybe why someone would want to get tested and screened today versus where we were 20 years ago, I'm going to use the words from the current Food and Drug Administration commissioner when he spoke at the American Diabetes Association meeting in Orlando about 2 weeks ago. He said that we, for the first time ever, are on the cusp of a number of breakthroughs when it comes to type 1 diabetes. What he also said is that the health system is failing people with type 2 diabetes because of these breakthroughs that we're on the cusp of on the type 1 side. A lot of data was presented at the ADA meeting around this. But to hear that level of optimism from the number one regulator of the drug supply system and the medical device system in the entire world say that, it sure was heartening to me and sure was interesting. But these therapies obligate us to catch type 1 diabetes before it's full blown. So you probably could get yourself in clinical trials. There's some therapies that are out there now. You have options. And it's important to discuss those options with your doctor. It's one more very important tool that's available to help folks make appropriate decisions about their healthcare. And that's my thinking as a layman.
Thank you so much. That's a great note, honestly, to end on. We're a little bit over, but thank you for sharing the reason why. I mean, we're on this call, so we all know the importance, but I think people like to hear from.
I'll also say, if I were seated with the commissioner of the FDA, I would give him a different perspective about type 1 diabetes and how we're still really, really way back in time and not necessarily making the improvements that are necessary. I would put us more with the type 2 community, but he's optimistic. So let's go.
Yeah, we could use that. Thank you. Thank you. So thank you all to all of our panelists and everyone who tuned in today. I know we had a date change, so I hope that you were all not bending over backwards to make it. But thank you everyone who joined us today. And thank you again to our wonderful panelists.
Thank you.
Have a great day, everyone.